standards for extubation as far as when you're doing it.
Okay, standards.
Here we go, it's better. So, you're going to monitor their vital signs closely while you're doing it. You want to check their level of consciousness, their LOC. You gotta watch out for some risks that could happen. So you need to make sure you know this that's associated with extubation, extubation. Okay. There could be some laryngospasms because it had that artificial airway in there, so it could swell and close up. So you gotta watch out for that. Vomiting could be a complication too. And so you want to make sure you watch out for those things. And then also you want to monitor their ABGs, you know, make sure they're getting enough perfusion.
Okay.
And then you want to make sure you position them in a position that's easy for them to breathe, like sitting up. Okay. Also, when you remove it, you got to have them in a high Fowler's.
Okay, high Fowler's.
Yeah. And yeah, position for easy breathing and drainage of secretions, you know, that might be built up in there. Secretions. And you always get to check their SpO2. That's the second thing. And it's still gonna go on. So if you know all of these things, you should be able to answer any way they ask you about this. Okay. So you always, you know, this is 3, want to confirm patient understands what's going to happen when you're going to extubate them. You want to make sure you follow infection control because it's, you know, around the nasal and oral orifices. So, also, no feeding 4 hours prior. Okay, 4 hours prior. Okay. Or if they're on an NG tube feeding, you're gonna have to stop it, right? And then you might have to aspirate some of the fluids left in their stomach, if there is. Okay. So then from all this, you got all that, so then you gotta place them in a high Fowler's because you're gonna get them ready to do high Fowler's. You gotta hyperoxygenate them, you know what that means?
O2?
Yeah,
okay.
Hyperoxygenate them. Okay. And always, you know, privacy and dignity. And then, and this is post after you've done, continually monitor them. And then their ABGs, you want to continue to monitor every 1 to 2 hours.
Okay.
And they're going to need humidified O2. Humidified O2 for them.
Okay.
Also, just keep in mind you should have also, along with, you know, emergency equipment, make sure you have what's called some racemic epinephrine, just in case their airways start to close up.
Okay.
Okay. In case of acute airway edema, because it could swell up, you know, pulling it back up. Yeah.
You could erase it.
Okay. The next subject. They're gonna have a lot of the same things. These are just stuff that I saw that were different.
Okay.
Okay, this is gonna be again on tricyclic antidepressant. Cyclic. Okay. Oh no, I spelled it wrong. Here I go again with my fluidic. Right? No. Tricyclic. I guess. Is that it?
Okay.
Antidepressants. Okay. So you have to really monitor as far as dosage. It's going to depend on their age, okay, 2, their physical health, and what their response to the drug is. Yeah, because it has a narrow, one of those drugs that has a narrow therapeutic range. So with older people, it's not really the drug of choice as far as antidepressants, because they're at more risk for toxicity because of their liver and kidney function aren't as efficient as they were when they're younger. Okay, so not the first line of choice. So side effects are going to be drowsiness at first until they get used to it. Drowsiness or sedation. In the first few doses, so that's normal until they get used to it. Okay. Okay. So they get started at first with a single bedtime dose. I'm gonna put bed BT dose. And that's for, this can also be used for depression, and then also helps them if they have sleeping problems.
Okay.
That's why they can take it at night. Sleep issues. And then after, they get used to it, you want to titrate it. Titrate it. But you always want to try to get the lowest dose that's effective. Okay, you don't want to go up really high if you don't have to.
Okay.
So titrate it to the lowest, most effective, and then you go up. And you're gonna have them come in for monitoring like every 6 months and see how they're doing.
Okay. Now, what did you say? Trade it?
Yeah. So once they get it's almost like a dose just to get it in their system.
Okay.
And then they're gonna see after a couple of weeks, okay, how are you feeling? You feeling okay?
Okay.
And then they're gonna be like, well, I still feel depressed. Okay, we're gonna bump you up a little bit, okay? And see how that's going. And then they will give it like 3 to 6 months and see
Okay.
how they're doing. And then, after that, like yearly, if they're doing okay. And then you always let them know if you have any kind of side effects or it's not working, be sure to call the doctor.
Okay.
Here she goes. Evita. Hello.